Hey, Dr. Lindsey and Wendy here.
I'm fixing my thingies. All right.
We're going to take you through a guy he's not about my age too. He's like 3 years younger. Everybody's my age.
This month was been Dr. Lindsey's age.
And he's a tough guy also. It had not tough like me, but tough like the last video that we just did.
Yeah.
And that's important clarification. We just did a different video on a real tough guy, and this guy's
your second toughest one.
They're right about the same. And so this guy had 2 previous transplants in the past, and his problem was that he had kind of a pluggy hairline and really not much going on in that frontal third. And he's going to lose more behind that because he's getting older. And so when we do this repair cases, as we talked about before, you got to be able to see to make holes close enough to the hairs that the customer's already paid for someplace else, that you don't kill them, and then you got to be able to put the hair in those holes successfully enough that the existing hair doesn't inhibit you and the other people putting the hair in or pull out the new hair in the first couple of days. So this is the way we do it. We trim him down, and now you can see in this view his real issue is that the guy that did him before, his first case, put 2, 3, and some 4 hair grafts right out of the hairline. It looks pluggy.
He had, what were those called?
Those were called micrografts.
Micrografts? Yeah, because...
But micrografts were in the mid-90s, and that case was done a little after 2000 by a well-known hair transplant doctor. And so even if you're well-known, it doesn't mean you're doing good stuff.
Yeah, because they definitely look like plugs, but if you look at his back, it was a strip case.
Right, and then he went to another fellow and had a strip. And I think he didn't feel like he got much out of that, and I would agree with him.
Yeah, it didn't look much like anything.
So when you're looking at this, you can see kind of a rim around the edges of those micrografts.
That was from first hair transplant.
And then you see all these miniaturized hair in the whole recipient area, which is this hair that's going to go away. And
that's what we thought. That the second guy that did it, it doesn't look like anything that much happened.
Right, and so all you see is this scar, which is pretty wide. And this is a tough dude that is forced by his job to have a pretty short haircut. And so we cut that out of him and sewed him up, and hopefully it'll turn out to be good. I know he's leaving the country for a while, and said he's going to email me some pictures, but hopefully he'll get a same scar or better, hopefully better. And then we trimmed down the hairs that he'd got before and made holes right beside him, and you can see that in this picture. And then we shaved those hairs off so that you could, because there weren't many of them, and so you could put hair in. And he did a good job cleaning, and here he is on day 7 this morning when he got his stitches out, and he did a good job cleaning.
Yeah.
And now we won't hear from him for a year, probably, unless he's got some kind of trouble. But this should turn out well, and hopefully we made him happy, and he was a real character to work on.
Yeah, like the next day, he wanted me to shave his whole head, the same day, and buzz cut him, and I was like, nah. So the next day, I did.
Yeah.
Like, I cleaned him up, and he looks really good. I mean, this matches whatever we cut on the side, too.
Yeah, I mean, he's leaving today to go back and be with a bunch of tough guys and take care of some problems. And, anyhow, he's a real character to work on, and I think he'll turn out well. And hopefully we'll get a picture of him in about 13 months.
Yes.
But if we can help you, please give us a call. Thanks.